I would say it's very, very common. So up to 50% of women have some sort of urinary incontinence and some level of it. So as we age, the likelihood of urinary incontinence is higher. Obesity is a risk factor, so as weight goes up, there's more risk as well. Having babies, of course, increase the risk. There's some argument of how much it matters if you have C-section or vaginal delivery, but vaginal delivery is thought to be a higher risk factor. If there's any family history of urinary incontinence, that would be a risk factor as well. Stress incontinence is when women have incontinence associated with increased pressure in the abdomen, so like with coughing, sneezing, jumping, that sort of thing. Very common in younger women, especially after childbirth. Urge incontinence is more so when a woman like all of a sudden feels like she has to go void immediately. And then mixed is if you have kind of both of those together, which isn't uncommon. And then the last type, the overflow incontinence, when there's leaking or dribbling with incomplete bladder emptying, or if the bladder is full, then there's incontinence there. Physical therapy is a really great option. There's pelvic physical therapy, so therapists who are specially trained in that field. That's the most helpful because it gets to the root of the problem and really treats the structural issue. Sometimes the muscles are too tight or not strong enough. And then there's medications directed at each different kind of incontinence that can be helpful. And then lastly, there's more aggressive options like surgery. So the diagnosis is primarily based on the history that the patient provides. Surely there's testing that can be done, and that's usually done by a specialist rather than us here in the primary care clinic, but we can diagnose it here based on the history that they give us. I think it's just important to know that it's very common and you're not alone, because it's kind of an embarrassing thing to talk about. So I think that's why people don't so much. And just to know that there are good, effective treatments, and not always the medication even, but therapy and things like that that can be helpful long term.